please welcome to the stage Alan Simmons.
Thank you. Thank you. Good morning and welcome to the Skills Show. Can you hear me okay at the back? Yes, you can hear me okay. Great. Anybody come and hear me talk before? Okay. You're very brave. Right, my name's Alan Simmons. I work for the NHS and we manage the Health Careers Service. So if you want to know more about careers after this session, then just go through the arch, just past the hairdressing there, and straight ahead of you, you'll see the ambulance and my colleagues on the health career stand. What I'm going to do today is have a chat with you briefly for about 15 minutes or so about the range of careers within the NHS, particularly the NHS. But many of the careers I'm going to talk about are within the health sector in its wider sense. So, if you put the NHS on the world stage of employers, we're actually the 5th largest employer in the world, which is quite interesting. We used to be, we used to be the 4th largest, but McDonald's decided to pip us at the post. I did say McDonald's took us over, but they haven't actually taken us over. They're just a bit bigger than us. So we are the largest employer in the UK, we're the largest employer in Europe, and we're the 5th largest on the world stage. A very large employer, around about 1.7 million if you include the NHS staff working in Scotland, Wales and Northern Ireland too. So, quick question for you, if I can get my slide to load. How many people here watch Casualty? Well, we've got 4 hands up, mainly from the parents, I think. Okay, how about Helby City? Anybody watch Helby City? Same hands going up? Okay. Call the Midwife? Oh, a few different hands going up this time. And how about One Born Every Minute? Anybody watch that? There's some people's hands gone up every time on that one, that little quiz. You must watch a lot of TV. Now, the interesting thing about these programs is that they tend to focus very much on a small number of staff. Nurses, doctors, midwives. Sometimes you'll see the odd paramedic. Some of them are a bit odd, actually. And you'll see a few other staff. But when was the last time you saw somebody working as a biomedical scientist? Or as a speech and language therapist? Or a radiographer? Yeah. Or perhaps somebody working in public health? Working with people to improve their lifestyle. You don't tend to see those people. So the key message I want you to leave with, if nothing else today, leave with a message that it's not just doctors, nurses and midwives. We do need those staff, of course we do. But there are so many other careers within the health sector. Okay, are you all ready for this? Get your eyes peeled, here we go. Stop. Okay, so there's actually over 350 different careers within the health sector. I've got a list that I've been compiling over the last few years that runs to about 470, and it's forever increasing. So some of those roles up there may surprise you, and that's partly why we're here today. We're trying to get you to think broader than perhaps some of the perceptions you have of opportunities within the health sector. Now, if you put those careers onto a pie chart, you'll see that in this sector here, doctors and dentists, nurses and midwives combined make about 37%. 4% are healthcare scientists. So actually, we employ around about 50,000 scientists, and they work in 55 different areas of science. Some are laboratory-based, have no patient contact. Some have a lot of patient contact. Come to our stand and we can tell you more about that. I'm not going to go through the whole chart now, but you can see there are lots and lots of different types of role. And you did read that correctly. Towards the bottom, around about sort of 6 o'clock, it does actually say, sorry, my slide is going on its own, hotel, property and estates. We actually employ people in hotel services. We employ surveyors. We employ people involved in maintenance of the buildings and so on, as well as catering and so on and so on. So lots and lots of different opportunities within the health sector. Around about 50% of the staff in the NHS have got a degree or a professional qualification, but you don't need to go to university to come and work in the health sector. There are lots of other routes open to you. It depends on the job that you want as to the qualifications you're going to need. That's no surprise there, really. But you can come in through an apprenticeship into some roles. You can come in after a course at a further education college. You can take an approved university degree. You can come in after a degree. Or you might actually go and work in a different sector completely and then come and join the NHS or the health sector at a later stage. So, for instance, if you work in management, or you work in hotel work, or you work in catering, or HR, or finance, or surveying, you might do that outside the NHS and then come and join us in the healthcare sector. So there are lots of roles where you can transfer your skills across. Here are some examples of apprenticeships that I've spotted in the last 3 months. They're all, they've gone. Did you see them? They were so quick there. These are real live apprenticeship vacancies that have come up in the last 3 months, and you'll see that there's a real variety there. Some involve working directly with patients, some are administrative, some are very practical, some involve working with children, and they're all over the place, all over the country. Now, there aren't thousands and thousands and thousands of apprenticeships at the moment in the NHS, and indeed in the public health sector. But we are looking to increase the numbers that are available. So keep your eyes open, and if you want to find out more about apprenticeships, come and talk to us on the stand. If you want to look for vacancies, the NHS Jobs website and the Government Apprenticeships website are the two main sources to have a look at. So, you sat in the audience, you're thinking, yeah, well, maybe I don't know what I want to do, and that's fine. Talking to a lot of people who aren't really very sure what they want to do, and that's partly why you're here at the skills show. So I'll just give you some examples very briefly. If you like practical skills, here are some examples of some roles that you might want to consider. Thank you very much. So you'll see, moving from the left to the right, the further to the right you are, the higher the qualifications you're going to need. Who'd have thought that we employ people like art therapists, music therapists, drama therapists, very practical roles? We don't employ mass numbers of those people, but we do employ people with those creative skills. On the far left, you'll see a number of maintenance-related roles. The NHS has got a lot of property, and we do need to maintain those, but also we're extending and expanding, replacing some of the buildings that we've got. So we do need staff with those skills. Maybe there's something there that interests you. Perhaps you like the idea of working with children, and we know children are of different ages. I was a child once, a long time ago. Here are some examples of some roles that you can actually have working with children. Newborn hearing screener, for example, the first one on the top left. That's a role where you are working with newly born babies to find out what their hearing is like. You don't need lots of qualifications to do that. Obviously, you need certain skills to be able to do that well. And interacting with the parents is a key skill too. A lot of people that we talked to and have spoken to in the last 2 days, that I've spoken to certainly, have said, I want to be a paediatrician. Why do you want to be a paediatrician? Because I want to work with children. That's great. We would encourage you to consider that, but there are other roles that you can think about too, and this list just gives you some ideas. So we employ children's nurses. We employ health play specialists, so you're using play as a form of therapy. Okay, you don't have to be a paediatrician to do that. You don't have to be a children's nurse to do that, but it is another role that may appeal to you if you like the idea of working with children. Another key thing about the NHS, particularly the NHS, is that people tend to think about the NHS as being hospitals. In England, NHS healthcare is delivered by around about 1,000 separate organisations. 1,000 separate organisations. And only about 10 to 15% of NHS healthcare is delivered in hospitals. Now, if you just watch Casualty in Holby City, you would think that that's not the case. You'd think all care is delivered in hospitals. So you've got to think, if you're thinking about working in healthcare or public health, think about the range of places where you could work. And again, if you want to find out more, please come and talk to us on our stand. The third example I want to give you is combining science and working with people. If you come to our stand, you can talk to some of the healthcare scientists we have working there. Anybody know what phlebotomy is? Phlebotomy. Yes, sir. Do you want to shout out what it is? Taking blood is the answer. It's also sometimes known as venipuncture. Now, you can't take blood remotely. You've got to be with the patient to do that. So you can work with patients using your skills and interest in science. At the other end of the extreme, if you want to go on and do lots and lots of study, you could perhaps be a pathologist running pathology testing. You're testing blood, urine, tissue samples, and so on, to make sure that there is no disease present. We've got some audiologists on our stand, and they've attracted lots of attention. We had a young lady came to the stand yesterday who was profoundly deaf, who was interested in various careers. She had quite a long chat with the audiologist. So there's lots of opportunities, and if you like science and you like the idea of working with people, medicine, being a doctor, isn't the only one. There are so many other opportunities as well. Will you fit in? Now, this is a key thing that's come in since the Mid-Staffordshire inquiry. Anybody in the audience who's been following the news in the last few years will know that there was quite a lot of challenges thrown by the care that patients were receiving at a hospital trust in Mid-Staffordshire. One of the things that came out of that was a rethink of the way that we recruit staff, and the recommendation that if you apply for a course at university which the NHS is funding, or you're applying for a job or an apprenticeship, we need to make sure that you, as an applicant, will fit into our values and behaviours. So if you're thinking about applying for a course in nursing or midwifery or physiotherapy or radiography, you're thinking about an apprenticeship perhaps, in any role, clinical or non-clinical, patient-facing, non-patient-facing, you need to know about the NHS values. If you go onto our Health Careers website, and I'll give you the address on the next slide, the last slide, we've got a link there which will tell you all about the NHS Constitution, a nice little bite-sized pieces of information. So I would recommend that you find out about the NHS Constitution. It's really, really important. It only came into to practice from April this year. So it's not something that's been around a long time in terms of recruitment. You need to be aware of it. Universities are testing people and sussing them out at interview. So finally, if you want to find out more, come and have a chat with us on our stand. I've explained where we are just through the arch, and you'll see the ambulance. We've also got some publications which my colleague at the back can give you a copy of as you go out, or come to the stand and you can pick one up there. Do visit our Health Careers website. We launched it a month ago. You can use it on any device, lots of information, a couple of thousand pages of information. Do use it and find out more. And thanks for coming today.